Miss Shui. I'm Hannah, and that is Shin. We're gonna talk about the 3 joints that you taught us. The first one is the fibrous joint. This connects the bone together without movement, and there are 3 types of joints. So the first one is syndesmosis. This connects 2 bones by interosseous ligaments, and it has a slightly movable articulation. Examples are like the radius and the ulna. It is connected by the syndesmosis joint, and the other one is the tibia and the fibula. The second type of fibrous joints is the suture, which is it only occurs in the head. So the suture connects the different parts of the cranium, and then these are not movable. The third type of the fibrous joint is gymphosis. This is also not movable, and it binds the teeth together to the bony socket in the maxillary and the mandible regions. The second one is the cartilaginous joint, and there are 2 types of cartilage. The first one is synchondrosis, and it is very strong and stiff. This joint appears in childhood but disappears during adulthood most likely. An example can be the costal joint, the sternocostal joint, which allows the lung to expand. And the second can be the symphysis, which is slightly movable and permanent. Example can be pubic symphysis. The last joint I'm going to talk about is the synovial joint. This is the most complex joints in our body and allows free movement. There are 3 types of synovial joints. The first one is the uniaxial, which permits movement in one axis only. An example can be a hinge joint. It functions like a door opening and closing. So an example can be elbow. And the other one is a pivot or trochoid joint. It allows rotations along the vertebrae region. Example in the body can be like turning the head side by side, or along the movement of the forearm against the upper arm. The second example of a synovial joint is the biaxial, which is the 2 chief axes of movement. An example can be saddle or sellar joint. It allows movement in the sagittal and the frontal plane. It allows flexion, extension, abduction, adduction, and circumduction. Example can be like a thumb moving around. Another example of a biaxial is condylar or ellipsoidal joint. It allows movement except for axial rotation. The last example is multiaxial. This is a joint that occurs in a number of axes. An example can be ball and socket joint. It allows one part to rotate at almost any angle, like the hip area and the shoulder, where you can like rotate your arm all the way. And another example of multi-axial joint is gliding or plane joint. It allows only gliding movements, like wrists and ankles. Thank you.